Hello, everybody, and welcome to Nature Source Care. My name is Dr. Fonda Goldman. I'm a naturopathic physician, and in today's talk, I was going to cover homeopathy for more balance. And specifically, I am talking about the Bach Flower Remedies Scleranthus. So let's take a look. Note beforehand, the information presented here is for educational purposes only and should not be considered medical advice. For any symptoms that persist or worsen, please consult with a qualified medical professional. It's always best to determine the root cause of any disease and to develop a comprehensive treatment plan, especially with Scleranthus. If you've watched my other Bach Flower remedy videos, I'd say this is particularly true. And while homeopathy Bach Flower remedies can be very effective, they may not be appropriate for everyone or as a single therapy, so please keep that in mind. Okay, so Scleranthus Bach Flower remedy. Just a few words about general background. So Bach Flower remedies, if you're not familiar, are a kind of homeopathy. And homeopathy is a whole different paradigm of energy medicine, quite different from modern Western medicine, which is modern Western medicine is more of a biomechanical, biochemical model of disease and health, whereas homeopathy is more of an energetic, like people have certain energies, diseases, states of disease, states of health have different energies, that sort of thing. Okay, and therapies as well. So, if you want more background and history on Bach Flower remedies and homeopathy, I would check out my first Bach Flower remedy video, Walnut New Beginnings, because I get into it in depth there. So, but in general, the concept of Bach Flower remedies is that disease stems from an inner struggle. And so in my practice, I use Bach Flower remedies, especially when there's like mental, emotional, or spiritual conditions that need to be addressed. And if you're looking for more content like this, I would check out my playlists, Bach Flower remedies or homeopathy. Okay. So, so the keynote for this particular Bach Flower is, constantly changing. And the inner state is that as well. It's vacillating between different states. They can be mental states, emotional states, physical states, that sort of thing. Okay, so the first thing you want to check, is that somebody's constantly shifting. They may walk in, or you talk to them 1 minute and they have a certain idea, and then the next minute that's completely different. So they can be kind of hard to follow and kind of keep track of in terms of what they're thinking and feeling at that moment. Okay, so let's get a little bit into like symptom presentation for somebody who might be in a scleranthus state. So this might be somebody who seems pretty aimless, or they might have like a lack of direction or clarity. Um, or again, it's like the target's always moving, So they may seem clear one moment or one day, and then the next day things completely change. So they're constantly shifting that way in terms of their focus, so they don't really have a focus. And again, there's a lack of clarity typically, although in the moment they may seem very clear. Okay. So this can also, so it's kind of their actions are changing all the time. Then it can be like mental thoughts are changing all the time. And because their thoughts are changing, this can make them indecisive or seem very confused. Because it's like one day they'll be talking about this as if it's like, written in concrete somewhere, and the next day they might be completely opposed to it, the idea that they just presented and, backed up the day before. So that's possible. And again, some of this may seem extreme, but for some people, this is their reality. So also, somebody can vacillate emotionally. So they might be happy 1 minute, and then the next minute they're sad, and then the next minute they're angry, that sort of thing. So they're kind of like, again, vacillating that way. And as I've written down below, this Scleranthus remedy might show up, if we're talking about like Western diagnoses and stuff like that. This might be part of a plan. I don't think this would be all of a plan, but for people who are experiencing things like bipolar, ADD, ADHD, learning processing disorders, feeling overwhelmed or burnt out, and even people who have, history of abuse. Okay, for different reasons. So like the bipolar and ADD, that's probably like symptom wise may seem the most related. But if somebody has like a learning or processing disorder, they may have harder time literally making connections, like neurological connections, to see things through in like a speedy, kind of expedited process. Okay. Probably if it was just a learning or processing disorder, it wouldn't be as obvious, or as much of a change because it can be pretty extreme in terms of the changes that Scleranthus, demonstrates. But maybe, like again, if we're looking at deepest cause, root cause for why somebody might be presenting this way, because the other thing is that it might be that they're trying to accomplish things, but if there's again a learning or processing disorder going on, they may get frustrated, and because they get frustrated, they change paths. So the problem is more frustration with kind of the inner process, if that makes sense. Then people are overwhelmed or burnt out. If somebody's overwhelmed, it may just be that they have so many things that they're trying to synthesize, so much information or whatever that they're trying to synthesize that their brain can't keep up with it. Sometimes we just, some people are so busy or trying to accomplish so much that they just think that they're an infinite capacity. When, again, even computers will shut down if you give it too much information at one time, right? I mean, nowadays computers and gadgets are pretty fast, but and again, you know, our biology has not, evolved as fast as like, computing systems, right? And for somebody who's burned out, it might kind of look like Scleranthus because they'll be like, oh yeah, I'll do this. But then they're so burnt out that when they attempt to do it, they realize, they don't really have the energy or motivation to complete it. And they'll be like, oh, forget it. And then abuse, this could be possible because for somebody who's abused, especially early in childhood, they're essentially taught by the people who, are supposed to be caring for them not to trust themselves, not to trust their boundaries, because the people taking care of them or supposedly in charge of them or taking care of them, they keep crossing those boundaries and not respecting those boundaries. And so because of that, somebody learns not to uphold their own boundaries with others. And so if they don't hold up their own boundaries, then they may lack a sense of self. The other thing is if there's abuse involved, then they may end up being like a people pleaser type of person because they're trying to keep the peace. And so they don't even know what they themselves, again, this gets back to like authenticity and possibly other remedies, which we'll cover on the next slide. But, if they don't have a clear sense of self, they won't know what direction they want to really go in. And they'll just kind of, again, and we'll get into that, like they can be easily influenced by others because, again, they just don't have a clear sense of self. So it's not that their mind is vacillating or their emotions are vacillating, but they don't have, a strong sense of self or strong personal identity or, kind of a strong center that holds for them, regardless of the outer, people around them or trends or times or, whatever, environment. Okay. So getting back up. So anyway, not to digress. So let's go back up here. So again, mood can change. So, 1 minute happy, next minute sad, next minute angry. And some people really do shift that fast. I think most of you know, I spent 3 years working inpatient in an inpatient psychiatric hospital. And there were some patients who were really fast cycling, fast cyclers, who had bipolar. And like literally 1 minute they're in bed and, they can barely move. And then an hour later, they're like happy and joking with staff and patients. And it's just like, wow, is this like the same person? Because just an hour ago, they could barely get out of bed, literally. So some people, that's their internal, physical, biochemical, mental state, so. Um, so again, they may be more reactive to people or the environment or circumstances rather than being directive. So, whereas like, if some little bump in the road comes up, that might throw them off track versus if they're very directive and they're like, this is what I want to do. This is my goal. I'm going to get there no matter what comes up. I mean, I can be flexible, but I'm still going to keep going forward in that direction. That's a different kind of, MO, right? So, again, easily influenced by others because, again, they may not be clear on what they want or, again, they may not trust themselves on various levels. They can also have big shifts in opinion. So one day they're claiming this and this and this is true, and the next day it's like, the opposite's true. It's like, okay, so which is it? So they might seem to others to be unstable, unreliable, flaky, some people might call them. They might, again, be indecisive, and they might procrastinate because, again, they can't even decide what goal they want, to pursue. So they never even like start the goal, or they never clarify what the goal or direction is. They haven't. Some people don't even get that far. And again, they may change. They not only may they respond to their outer environment, changing and different people, having conversation with different people with different opinions or whatever, and kind of catering to those things rather than staying true to themselves and their, what they've decided for themselves. But the thing is, it might also literally show up as like their environment, like their room or their clothes are constantly changing. Like maybe one day they dress in a very formal classic outfit or something, and the next day they're like boho casual, cowboy boots, like a very different vibe. I do actually know like somebody who is a hairdresser, and every time I go in there, which isn't too often, but every few months or so, and like literally the furniture will always be different. Always, every single time. Like I don't remember going in there twice and the furniture being in the same place. Like something's always moving, and it's interesting, I guess, but it's also it creates this, at least for me, a sense of unsteadiness. So I guess I'm sort of, there's steadiness in the unsteadiness. I guess I sort of expect it every time now. And I'm more surprised when the things are in the same place that they were last time, but I don't recall it ever being the same. So, you know, um, there you go. So, yeah, and what else? And that's like, again, if this is like a patient showing up in the office, this could be somebody whose symptoms are always changing. Like maybe the symptoms that they have in their body, like maybe the pain is changing or the inflammation's changing or the skin is changing or whatever. Maybe the conversation is always changing. Like maybe one time they talk about this, like it's like their primary concern. And then the next time they come in and they've forgotten about that. And now there's this other thing. And sometimes things change like that for sure. But if it's every time they come in, like you see that the pattern is like with them internally rather than like legitimately, it's not even like these things are really changing that much. It's more that their focus is changing, you know, um, or like the topic of like they have a really hard time even like focusing on a conversation to get to the bottom of any symptom that they're presenting with. Yeah. So anyway, yeah. So they can, it's like a a moving target. A lot of these folks. So the risk here is that they're unable to obtain goals, whatever goals, small, large, life goals, whatever. And the thing is that if this goes on long enough, it may become part of their identity where they're just like, oh, I never achieved this or that. I never get that far, da 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 da, because they're so used to being indecisive or back and forth about things that they have some track record or history of not completing things, but then they're like, oh, it's me, as opposed to it's some sort of internal process which may be able to be addressed, possibly with Scleranthus. Okay. So the potential outcome if somebody takes this remedy is that there will be clarity, there will be confidence, there will also be calm. Because again, there's this like restless nature with these folks. They're not like calm. They're not typically calm, steady, again, they're not calm, steady people typically. They will have endurance. They will have follow through. And they'll stay balanced, even when challenges present themselves and keep moving forward. And they will achieve goals more likely. Okay? So let's look at some other remedies that you might consider, if this is, somebody shows up like this in your world, what are some other remedies to consider? Again, also keeping in mind that, even this like short list and, it's a short list of more Western style diagnoses, might be, part of this person's picture history. Okay, so other remedies are other remedies, and I've listed a bunch here. The ones with an asterisk next to them are videos I already have published on my channel. So if you want to learn more about some of these, most of these videos are already done. Yeah, so agrimony might be one. Agrimony is like lack of authenticity. So these are people who are like always smiling, and sometimes it's like a little bit odd, like, why are you always smiling? Um, and even when they're talking about sad things. So the thing is, like, when this happened, there's like a lack of congruence between the way that they present the way they outwardly present and what's going on internally. And so this might be again like lack of clarity about self. Yeah, and also a bit of people pleasing involved in this. Then aspen is about vague fears, but sort of generalized anxiety. And they tend to be overly sensitive. So because they're so sensitive, this is like any little bump in the road is like a big mountain, potentially, and that might set them back. Okay. So they might like keep bouncing back from pursuing things because they're too sensitive. Okay. Then there's sensory, and this is really the big people pleaser. These are people who just, they can't. They're always catering to other people and their needs and wants or whatever. This is the big one. So that might be the whole story there, is that they're so constant, they're always constantly pleasing other people, but they're not, maybe they don't even know what pleases themselves, that kind of thing, because they're always focused on other people. Then there's Cerato. Cerato is for people who don't trust their intuition. So if they're just kind of juggling ideas, then maybe it's the intuition or not relying on the intuition, and so then they cater to other people's ideas. There's cherry plum. Cherry plum is about a healing crisis. So this might be a remedy when, how do I say, because some people won't follow through on things, because what happens is if there's a deep healing that happens in people and they do get clarity and they do get direction, and they do start focusing on goals. What I've seen with some people, sometimes they're very resistant to even taking like a remedy or something like that. And part of it is because on a deep intuitive level, they know that if they heal this one thing in their life, that means other things are going to have to change. So it's not like, so it's like the whole internal being system, internal operating system changes. So I remember one time in medical school, I gave this woman a remedy because she kept complaining about how she wasn't getting ahead in her career and this and that. And I gave it to her, and she started like, things opened up for her like gangbusters. But then she told me she realized that part of why she was resistant was because she knew that if things started taking off in her career, she would have to address things with her husband, and she wasn't really happy with the relationship anymore. So, those things can happen. So these deeper kind of unconscious fears of other, changes happening in life, prevent us from moving forward in different areas. Yeah. Then there's chestnut bud. This is people who keep making the same mistakes. So this is a little bit different, because somebody who's in the Scleranthus state, it'll be like no matter what they do, it's not even the same mistake all the time. It's like no matter what they do, almost, they can't kind of move forward. Clematis is for people who are not grounded. So this is people who are like lost in the ideal world. So like, like the artist or the professor who's just like lost in the world of ideas, and sometimes they have a hard time grounding and actually, moving, taking action on those ideas, bringing things into reality. Then there's elm, hornbeam, oak, and olive. These are on the same video, and these are all different remedies for different kinds of feeling overwhelmed or burnt out. Okay. Then there's impatience, which I've not done yet, but there's a video. Impatience is like literally you're so impatient. So this might be somebody who's like starts on their goal, and if it doesn't happen in like 5 days or a month or something, they're like, this is taking too long, and then they'll bail. So it's not, so it's more of a, I guess that would be more of an emotional state, is that they just lack the endurance. So there's that. Then there's larch. Larch is also like a confidence type of problem, This is due to more having an inferiority complex. So if you feel inferior, you're not going to put yourself forward to pursue any, high level goals, because you don't feel worthy of it. Then there's pine. Pine is for people who basically have like blame themselves for something that's happened in the past. They condemn themselves, and because of that, they don't feel like they are worthy for different reasons. They also don't feel like they're worthy of opportunities, and so they won't pursue them. Then there's red chestnut. Red chestnut is people who are like overly concerned for others, like parents who are like helicopter parents and stuff like that. So this is somewhat similar to the century, but this is like I would say not quite as imbalanced. And it's not like these people don't ever take care of themselves or completely bend, their will, toward others bend their will, or they bend their will towards others, desires or whatever. This is people who like the parents who can't sleep at night because they're constantly worried about their kids. But this might set people back because you're burning a lot of energy. All this, time and worry and anxiety when you could be, if you can stay calmer, then you can, even just sleep better, get rested, and then you can, approach these tasks with, probably more efficiency. Then there's walnut. Walnut is for life transition. So sometimes people, whenever there's a big change, ahead of them, like they get, worried internally or, they're anxious because it's like, they're out of their comfort zone essentially. So it's kind of this, helping people to adapt, and that might be why people don't move forward is because they're like, well, I don't know what's on the other side. So, I don't, even if it's again a subconscious fear. Then there's white chestnut. This is for people with repetitive thoughts. So this is going to present differently than possibly Scleranthus because this is an even it might be close to chestnut bud a little bit because chestnut bud was about repeating the same mistakes, but white chestnut is about repetitive thoughts. So this is like analysis paralysis. So these people, this might be the person who never figures out what goal to pursue. So that's why they don't pursue goals. They don't even get that far. Like that might be this person who just has the same thoughts, cycling in their head, and then they can't move forward mentally. Then there's wild oat, and this is for people who have a hard time figuring out what their life purpose is. So, yeah, again, because they're like, well, maybe I could be a nurse, or who knows, maybe I could be a professional bike rider, and they're kind of all over the place. And sometimes this is, for like a lot of kids or younger adults, like, this can be just a phase of life, right? But for some people, like they're constantly in the state, like they never grow out of it, type of thing. But wild oat might be another remedy to consider. Okay. The other thing to consider is another big thing that I do in my practice is Ayurveda, which is traditional Indian medicine. And in that system of medicine, there are essentially three main categories of imbalances. So there's too much wind, or they call it vata, too much fire, they call it pitta, or too much earth, or they call it kapha. So when somebody's all over the place, like the wind, blowing here, blowing there, blowing like a hurricane or a soft, and then scaling back to a soft summer breeze, that is somebody in a windy, high vata state. Okay. Now I have a lot of vata, videos on my channel. If you're interested in pursuing that line of therapy for this kind of presentation, beyond the homeopathy, then I'd probably start first with my Ayurvedic Vata wind diet because, a lot of foods like that may be part of, again, from an Ayurvedic point of view, maybe somebody who eats a lot of cold, dry foods. Like usually my windy people, when I ask them what they eat, they usually have a particular, not just what they eat, but they have a particular way of eating. Like they're usually grab and go types. They never sit down. They're always on the go. They're always grabbing like, chips or cookies or, things that are hard and dry. They don't, just sit down and take time to cook and this kind of stuff. And they're often in a windy state where they will be all over the place. Their energy will be all over the place. Their symptoms will be all over the place. So that might be another thing to consider for somebody who's presenting in what seems to be a scleranthus state. All right. Okie doke. So, as always, thanks for hanging out and listening to one of my talks. I appreciate all your support on the channel. and my work as well. So everybody who subscribes and likes and comments and shares, it's like a tremendous amount of shares. So I'm always impressed by the number of shares. I'm like, wow, you guys must really value the information presented here. So I'm glad it's, it makes me know that it's worth my time to do these videos when I can. And sending in donations, all of that is very much appreciated. I do have a couple books on natural medicine. If you go to Amazon.com and go to the book section and search under my name, you'll find them. I do have another YouTube channel on Vedic astrology, so ancient Indian astrology. It's more than 5,000 years old. So I do ancient Indian medicine and ancient Indian astrology. And the name of that channel is Light Vedic Astrology, if that's interesting to you. And then most of the photographs in my videos I've done myself. I have an online photography gallery and gift shop. So here's the link if you're interested in that kind of thing. If you're interested in photography or, providing interesting and unique gifts to yourself or other people. All right. So as always, take good care, and until the next one, namaste.